Hello once again, everybody. I am Wanda Thibodeau, and this is part 3 of my report on disordered eating. This is the result of a very large research study that I did in the quest to write a book. I interviewed many people, sent out many surveys, and it's also based on my own experience. So if you haven't seen the first 2 videos that I have, I strongly recommend that you do go back and watch those so that these recommendations make sense. In this particular video, I want to basically address professionals, friends, family, and the eating disordered individuals themselves. There's a few words of encouragement and caution that I want to say as a wrap-up to this series. So first, I'd like to address any professionals out there who might be, or people related to professionals in one sense, or in any sense. There are several things that I do want to say to you. If I could just say one thing, it would be don't assume. Don't assume that you have, that you know more about the disorder than the eating disordered individual themselves. There's no guarantee that your patient will follow whatever tendencies may exist in the disorder. So don't assume that just because the literature says this, that's probably what's going on. Treat in each case individually. Your patient will respect you so much more for getting to know them as a person rather than taking them as a statistic. Start from scratch with everybody. Just don't assume anything. Also, don't assume that the same treatment is going to work for everybody. A lot of, especially in treatment centers, it's not very individualized, or it's not individualized enough. But people are very different. They have very different personalities. They respond to things in very different ways. So you have to take a slightly different approach with every single patient that you have. Make adjustments when necessary. Don't see that as an inconvenience. See that as part of your work. If that's what's going to help the individual, that is your responsibility as a therapist. Also, be sure to examine your own beliefs. If, whether or not you're using cognitive behavioral therapy or, as I described in part 2, Weissian therapy, if you're not able to examine your own belief systems and understand how they are formed and understand how, whatever cultural biases you may have, personal biases, if you're not able to understand how those were formed, you can't possibly expect to lead your patient through that same kind of work and discover why they have the same kind of beliefs. So you have to start with yourself. Examine yourself so that you are better able to understand what the process is like. Also, utilize the power that you have as a therapist. You are a professional. Culture gives you a lot of standing in that sense because you have that doctorate or that master's or what have you. Because you are a professional, use that power and that significance that you have and that we give you to lobby for a better system. Use it for good. Instead of just, if managed care is horrible, bury legislators in paperwork. Do whatever it needs to take, whatever it takes to get out there for your eating disordered patients and get them what they need so that their care is covered for and that they don't have to worry about those things. Also, consider the opinions of those who are not professionals. It will help you to understand how people outside of the therapeutic field view the disorders. It will help you see maybe alternatives to treatment that you didn't see before. All those kinds of things. Also, those without the degrees tend to be non-biased in terms of how, a professional will view it through a professional lens. So sometimes that fresh look from somebody who isn't a therapist is very refreshing because you can understand how you're coming off to the public and to eating disordered individuals. So it's very important that you look beyond your field. And lastly, work collaboratively in that sense, both with other professionals outside of the therapeutic realm. Work with your patients collaboratively. Every session should be between you and your patient, not just you listening to your patient and then telling them what to do. There are some things, and this kind of goes for parents and friends as well as professionals. But there are a few things that you should never, ever, ever say to somebody who is suffering from an eating disorder. I'll provide the rationalization for each of those. First, don't ever say to just eat a little. To somebody who is anorexic, that doesn't exist. Eating an egg is the same as eating an 8-course dinner. To somebody who is bulimic, they're coming to you because they can't eat a little, or they have trouble with it, or for somebody who's an overeater. They're coming to you because they can't eat a little. So it's very patronizing. You know, it's like saying, well, just do that. It's easy, isn't it? So it's very patronizing, and it's very negative. It's very offensive in that way. Instead, try to work with, encourage them to eat whatever they are comfortable with. Of course, you know that you're always building that up. But let them know that you're going to be right there, and that you will help them, you know, as they struggle through every bite, you know, those kinds of things. Try to avoid saying a little or a lot, those kinds of things. Just work with it based on what they need. Also, the next thing is, don't say that they're sick or mentally unstable, even if they are. The reason for that is they will focus on the fact that you said that they are sick. They will take it as a negative thing, and they will latch onto that, and they will think to themselves, I'm sick, I'm worthless, they've said so, and they'll just take it in a very, very negative way, and they'll use it as more fuel. Instead, you can make a list of concerns that you have. For example, you know, I'm really concerned for you because I've noticed that you've gotten so thin that you can't sit without pain, and you deserve to be able to sit without pain. So how can we, again, focusing on goals, how can we together make it so that that's a good goal for you, and so that you can achieve that goal of being able to sit comfortably. You know, because most people, you deserve it, and most people can. So say it in those terms. Next, don't say that the individual can't do something. For example, you know, you can't engage in this behavior. That's forbidden in this treatment plan. Don't say that simply because it implies a standard that it is correct or incorrect. And even though it may be correct or incorrect, the individual has to make a judgment for themselves whether or not what they are doing is correct or incorrect. They have to choose for themselves whether or not they are going to engage in that behavior. Instead, focus on what they can do. You know, I've noticed, even saying something like, I noticed that you ate that egg yesterday, or whatever it may be. So today, you know, I want to help you eat the egg plus whatever, you know. Focus on what they can do and all the successes that they have had. Saying that you can't do something implies that they are unable, and they'll focus on that. Believe me, they will focus on that. Next, don't say that they will outgrow the disorder. That is one of the worst things that you could possibly say, because first of all, it totally ignores adult cases, and it's very patronizing to adult patients. It trivializes the disorder in the sense that it makes it sound like whatever is causing the disordered eating is a very, you know, it's an adolescent angst kind of thing, and in reality, a lot of the time, they're very adult issues that are being dealt with. So don't imply that it's just a phase, because many times it's not, and they really do need assistance, you know.